Hi, everyone. Thanks so much for joining us today. We're going to go ahead and get started. My name is Nora, and I'm the Senior Development Associate here at the Fund for Public Health. It's my pleasure to welcome you all today to our public health talk on e-cigs. A few technical notes: if you have any questions during this call, you can type your questions into the Q&A or question feature using GoToWebinar. We will do our best to get to as many questions as we can after Kim presents. This webinar will also be recorded and a copy will be sent to you afterwards. If you experience any technical difficulties during this call, please let us know by emailing info@fphnyc.org. Now I'd like to welcome Sarah Gardner, the Fund's Executive Director, to get us started.
Hi, everyone. Welcome to Public Health Talks with the Fund for Public Health in New York City. As Nora just said, my name's Sarah Gardner, and I'm the Executive Director. The Fund, for those of you who don't know, the Fund is an independent nonprofit that exists to improve the health and wellness of millions of New Yorkers. My team and I build partnerships and secure funding to advance our city's public health. And as you can imagine, today more than ever, we need innovative solutions to address our most critical public health issues. We design these calls so public health supporters, people interested in health like you, can learn more about the urgent issues facing New York City and to hear about some of the incredible work that's being done by the health department on behalf of millions of New Yorkers. At the end, you'll also learn a little bit more about the Fund for Public Health and how we work with the City Health Department to incubate innovative initiatives to address critical issues. So thanks so much for joining today. Now I'm excited to introduce our briefing topic and special guest. Kim Kessler is the Assistant Commissioner for the Bureau of Chronic Disease and Disease Prevention and Tobacco Control at the New York City Department of Health and Mental Hygiene. Kim leads an interdisciplinary team focused on promoting healthy behaviors and shaping the environment to facilitate healthy and active living for all New Yorkers. I'm sure most of you have been reading the headlines recently about the alarming rise in e-cigarette use, particularly among our youth. It's very challenging to parse out fact from fiction, and at times we can be left feeling a little bit confused. Kim is here today to help us sort through the facts, and she'll be sharing information about e-cigarettes and what the health department is doing to educate the public, but also to prevent and fight the alarming rise in e-cigarette use amongst our youth. So I'll turn it over to Kim.
Great, thank you so much for that introduction, Sarah. I'm really pleased to be here and to be able to join all of you. And hopefully you're able to see the presentation now. So as Sarah said, I lead the Bureau of Chronic Disease Prevention, and these are some images from our work. We work broadly on prevention issues with the goal of reducing the burden of chronic disease, which are the leading killers and the leading contributors to premature death in New York City. So things like heart disease, stroke, cancer, and diabetes. And we have a particular emphasis on health equity and addressing inequities. And we focus our work on how we can change systems, policies, and environments to make healthier choices easier for all New Yorkers. We especially look to the role of commercial determinants of health in our work, so things like the topic that we're here to discuss today, the role of tobacco in the vaping industry. So to give a little bit of context, before we talk about e-cigarettes, we really need to talk about tobacco use among youth more generally. This slide is showing that since 2001, we've seen a 72% decline in youth smoking among high school students in New York City, and we're down to 5% in our most recent data. This is actually similar, although an even greater decline, to the progress we've seen among adults. So what we know is that our collective tobacco control strategies, which include approaches like taxes, media campaigns, policy interventions, and denormalization of tobacco use, have contributed to substantial declines in both adult and youth tobacco use. But then this brings us to where we are today and this incredibly serious new threat of epidemic rates of e-cigarette use among youth. What we really worry about is the seriousness of losing all the ground that we've gained in terms of nicotine exposure and addiction to youth by now putting this new generation at risk of that kind of addiction, as well as exposing them to ingredients whose safety just hasn't been tested and long-term health outcomes that we don't know about. What I want to go over today is the data behind this explosion in youth use, the reason that we're so concerned about e-cigarette use for youth, the role of marketing and flavors in contributing to how we got here, the recent outbreak of serious lung injury, and then how we've responded here at the City Department of Health. So on this slide, you can see the cigarette use that I just described being at 5%, and then other forms of nicotine and tobacco use, smokeless products, cigars and cigarillos, and then e-cigarettes and vapes, which it's clear how much greater of use that they're having among today's generation. So we're up to 17.3% of high school students using e-cigarettes, and this is current use, meaning in the last 30 days. And what's really important to be aware of is that this is in contrast to only 2.5% of adults in New York City reporting use of e-cigarettes. And to really underscore what we're seeing in youth, we, for the first time this year, were able to take a look at our middle school students. And this is data we released earlier this fall on use among middle school students. And what you can see is overall, we had about 7% of middle school students reporting current use of e-cigarettes, but those numbers getting a lot higher as the grades go up, with 9% and 8.5% for 7th and 8th graders respectively. And if you look at not current use but ever tried, it's about 1 in 5 8th graders that report having tried e-cigarettes. So what are the health risks that make this such a serious concern? I want to highlight that the specific composition and formulation of e-liquids is not currently regulated, including the concentration of nicotine in each product. So there really isn't any entity that's ensuring that what companies say is in their product or how much is what's actually in there. And we also know that the aerosol from heated e-liquids can contain harmful chemicals like formaldehyde and benzene, which are carcinogens, as well as heavy metals like nickel, tin, and lead, among other flavorings and potential chemical exposures. The bottom line here is that we don't know what the long-term health effects of e-cigarette use are. We do know that kids who use e-cigarettes are more likely to try cigarettes, and we know that this is essentially making kids of this generation a guinea pig for this new kind of product. How did this happen? What we see in the explosion of use of e-cigarettes, we can look back and see that there was just a gap in policy in terms of this emergence of a new technology, a new type of product, and industry efforts to keep things that way so that there was minimal regulation while the product got established. The product itself is very appealing to youth. It's very modern, it's got the tech appeal, and then the wide variety of flavors. There are thousands and thousands of different kinds of e-cigarette flavors on the market. And then marketing has also played a big role. Industry marketing has been aggressive, historically youth-facing, and with using strategies that are very similar to what we see in tobacco marketing, with appearing to promote very kid-friendly packaging and flavors, as well as themes like rebellion, glamour, and celebrity endorsement. Social media has also been a huge part of this. It's helped to fuel the popularity of e-cigarettes among teens. Juul, which is by far and away the product leader in the category of e-cigarettes, was one of the first major retail e-cigarette brands that relied heavily on social media to promote and market its products. So then that brings us to the more recent outbreak of vaping-related lung injury, which people are probably aware of. These are just some headlines of the coverage that this issue has gotten. But what's happening across the country is federal, state, and local health officials are continuing to investigate this, and we know that we're now up to over 1,800 possible e-cigarette-related lung injuries, and I think it's the current numbers, I think, are 37 deaths across the country. And this is mostly involving young people. So I think the numbers are that about half the cases are people under 25. 14% of cases are under 18 years old. And here in New York City, we have over 30 cases. And so this is something we continue to work really closely on with our state partners. Most of these cases do involve cannabis use, so people vaping oils that include THC, but the investigation is ongoing, and to date, no single substance, chemical, or product has been linked to every case. So the exact cause is not clear, but the health risk is, for now, is enough that we are recommending people not use e-cigarettes while the investigation is ongoing. So I would like to take a little bit of time to share with you what we've been doing here at the City Department of Health. Our approach includes policy, education, outreach, and then ongoing research and surveillance to inform our efforts and let us know how effective we're being. And just to give a quick highlight of these, a couple of examples. So for e-cigarette policy, New York City has included e-cigarettes in its Smoke-Free Air Act as well as its Tobacco 21 laws, so that e-cigarettes cannot be used anywhere that cigarettes cannot be used, and youth under 21 cannot, the law prohibits purchase of e-cigarettes by this age group. However, until last year, we did not have a specific license that was required for the sale of e-cigarettes, which made it difficult to enforce our Tobacco 21 provision. So this new license was created, and it actually has a retail cap also, so that everywhere that applied to get an e-cigarette license had to have been in business by a certain time, and no new licenses will be available until there's a 50% reduction in licenses across communities in New York City. Pharmacies were also ineligible to get a license, so there was an effective pharmacy ban on the sale of e-cigarettes. We've also done a lot of outreach and education around this topic and issue. We had a specific effort where we worked with communities to bring awareness, particularly with groups that serve youth, to the topic of flavors, both in e-cigarettes and in tobacco products and menthol specifically. We began this effort with listening sessions and gathered information about what youth were concerned about, what they were seeing in their neighborhoods, and then used that to create a toolkit that we shared with youth serving groups. And across the city, 66 groups pledged to undertake activities in the toolkit to raise awareness about these issues. We also held 2 public events that are featured on the slide, talking about this topic and what youth can do about it, and sharing their own experiences of tobacco use and vaping in their families and among their peers. We've also been working in partnership with DOE, our Department of Education, to give accurate information to principals that they can share with parents and students. So we created a parent-facing FAQ that gives basic information about what e-cigarettes are and what the risks are, as well as a handout that can be shared with youth and posters and other materials. We also did outreach to providers in June, where we shared guidance with pediatricians about addressing e-cigarettes and encouraged providers to begin giving guidance to youth at the age of 5 about tobacco use in e-cigarettes, and then begin screening at age 10 for e-cigarette or tobacco product use. And we know that while we have, through our tobacco control work in New York City, we have a lot of experience and established strategies. We know what works in terms of tackling tobacco use. We also recognize the need to update those strategies as we take on this new issue of e-cigarettes. And so we recently launched a new kind of media campaign that's a digital media campaign. It's on digital platforms that youth use, and it's youth-facing. So it's on Instagram, Snapchat, Twitter, YouTube. And it's talking about really the risk of addiction, but it also highlights that the chemical components that are in e-cigarettes and the kind of risks that kids are exposing them to. But the campaign gives the sense of how vaping can kind of take over if you get hooked. And that'll be running through the end of this year. So I wanted to also talk about really what's been an incredible partnership with FPH NY through our long-term work with the Fund on Tobacco Control. Over the years, we've received millions of dollars, primarily in CDC funding, but also from other partners, to help support the tobacco control work that really has been at the forefront of tobacco control nationally and internationally. And that wouldn't have been possible without the work that was done hand in hand with the fund. One of the challenges that we see with e-cigarettes is that you can see many of these grants were major CDC multi-year grants. We haven't had the same kind of funding stream open up yet from the federal government to tackle this new topic. In terms of going forward, this is certainly a huge focus for us right now because of what our data is telling us and because of what a concern we know it is among communities. There's so much happening as well on the policy landscape. Obviously, there's been a lot of response to the outbreak with emergency orders and bans being put in place, as well as additional non-emergency policy efforts to address this epidemic of youth use. So nationwide, we're currently awaiting federal action, which the federal government has indicated that they're planning to take additional action around e-cigarettes. We know in different states and localities, flavor bans and other restrictions on e-cigarettes have been proposed and adopted. We'll be continuing to do a lot more outreach and education, as well as keeping our eye on the tobacco industry more generally. The product that's actually featured on the slide is called IQOS. It's a Philip Morris product. It stands for I Quit Ordinary Smoking, and it's a new kind of heated tobacco product, a new technology that's just recently been introduced in the United States. So we're mindful of watching the tobacco landscape evolve and being ready to address that as well. So I'd be happy to now answer any questions.
Great. Thank you so much, Kim, for that presentation and for providing us with a really great look into everything you've been doing so far to combat the rise of e-cigarettes, and also informing us about everything that still needs to be done to address this epidemic. We have a few questions already, so I'll go ahead and jump right in. And to everyone who's on the line, if you have additional questions, feel free to use the question module in GoToWebinar, and we'll get to as many as we can. So Kim, the first question for you is, do youth only switch from e-cigarette use to vaping, or is vaping actually attracting non-smokers more often among youth than perhaps it might with adults?
Based on our data, vaping is attracting new youth who were not previously using cigarettes. Vaping, I mean, we saw the numbers of cigarette use go down a lot in the more recent years. Vaping has become incredibly popular really in the last couple of years. And so it is not, and actually among adults also, it's not a matter of people necessarily leaving cigarettes and turning to e-cigarettes. In fact, about 20% of New Yorkers who report using e-cigarettes have never smoked. And many more New Yorkers who are using e-cigarettes are current smokers than are former smokers. So it's really not something that's substantiated by either our data or evidence that e-cigarettes are an effective cessation device. There's really limited and mixed evidence about their effectiveness as a cessation device. And in fact, we're much more concerned about the risks that they pose to people who never were nicotine users, particularly youth, than their promise as cessation devices.
Great, thank you. To your knowledge, or does the data show how kids or youth know or care how much nicotine is in one vape pod? And perhaps could you speak to the different levels of nicotine? You addressed this earlier in your presentation, but a little more information about that would be really helpful.
Yeah, late this year, a new warning was required to be put on e-cigarette liquids that state that the product contains nicotine. Prior to that, there was no notification of that, and we think many youth actually didn't necessarily realize that nicotine were in e-cigarettes, and there's some data to support that they weren't aware of that risk. But now e-cigarettes should be labeled and to say that this product contains nicotine and nicotine is addictive as a part of an FDA requirement. At the same time, in terms of the concentrations, I think that's a really tricky thing to understand. E-cigarettes here in the United States can have much higher concentrations of nicotine than is permissible in Europe, for example. So one Juul pod can contain the amount of nicotine that's in an entire pack of cigarettes. I think what we're beginning to see in the market is actually more of the products with higher concentrations of nicotine.
Okay, great, thank you. Can you speak a little bit to the public perception, particularly among youth, about kind of the cool factor of vaping products versus smoking cigarettes and how that has influenced your work?
Yes, I think that vaping products do have a cool factor, and as I spoke of it just a very little bit about the kind of marketing strategies that when they were first coming onto the market, vaping products used. So they're very much looking glamorous, looking cool, young people doing fun things, and that does seem to be the perception among a lot of youth. What we learned in focus groups from youth is that our tobacco control ads, or the tobacco control ads around cigarette use, are something that has really penetrated our culture and youth are really aware of. So a lot of them spoke about seeing those ads and tobacco being something that they would never consider using, smoking traditional cigarettes, and that they associate that with illness and death. At the same time, they don't connect that to e-cigarettes at all. They see this as a new technological device, something that's safe, something that's fun, and we hope that will be changing, but what we've seen so far is that there is a perception that this is cool. And so we are working on that by trying to meet youth where they are, for going to digital platforms, learning from them about what their concerns, what information they don't have that we can give them, and then responding to those concerns with accurate information, because we think there's a lot of misconceptions and misunderstandings out there.
Great, thank you. I think we have time for one more question. Can you speak a little bit to the resources that are available out there, for cessation, particularly around e-cigarettes? We know that there are cessation opportunities for folks who are using tobacco, but it would be great to learn a little bit about what's out there for e-cigs and vaping.
Yeah, this is a challenging area because it takes time to develop the evidence of what successful cessation approaches will be for this new type of product. And that's still an emerging area of study. Fortunately, there is beginning to be a real response to recognizing that people may want to quit e-cigarettes and have that need, and that youth need support in trying to leave e-cigarettes behind because of the incredible addictiveness of nicotine. Very recently, the New York State Smokers Quit line updated their approach to provide nicotine replacement therapy in addition to counseling to people who are trying to stop using e-cigarettes, but that would be for adults. They provide counseling to those under 18, but for adults, they're able to provide medication support also. The approach, one of the main approaches that's out there for youth is a program developed by the Truth Campaign. They have a program called Ditch Juul. It's part of their This Is Quitting initiative, and it's a text-based program to support youth who are trying to quit.
Wonderful, thank you. So that's all the time we have for questions today. If you have any more questions, you can feel free to ask them, and we'll try to address them in our follow-up materials. But for now, I'm going to hand it over to Sarah for a few final words, and she'll share a little bit more about the fund and ways that you can continue to learn more about this work.
Great, thanks, Nora, and thank you, Kim, and thanks to you and your team. We're so grateful for the work you're doing every day to keep New Yorkers' health and safety safe. For everyone on the line, I just want to give a very brief overview of the fund and our role as an independent nonprofit and how you can get involved. As I said at the beginning, the fund exists simply to improve the health and wellness of millions of New Yorkers. And we do this in close partnership with the New York City Health Department by basically two ways: securing funds to invest in innovative pilots and test new ideas, and by expediting implementation of high impact programs. Since our inception in 2002, we've secured over $400 million in grants. Last year alone, we secured over $22 million to support 32 different programs that are currently being executed. And just a couple of examples is a grant to provide enhanced linkage to care for hepatitis C patients by testing a text messaging system, a pharmacy to farm program to increase vegetable and fruit consumption among low-income New Yorkers, and thirdly, a program to increase access to sexual and reproductive health care for at-risk youth. We really, at the fund, we really believe it's important for all New York citizens like you to have direct access to the experts at the health department. We really want to foster a deeper understanding of what public health is and the work that's being done by the city health department to keep New Yorkers healthy. We hope that by engaging with us that you can become advocates for the work. And because of this belief, we are launching a number of activities this year to make it easier for you to engage with us. One of them are these public health talks that we intend to do on a quarterly basis. And the other is to host a number of small events on that will highlight and have experts come to speak on critical issues. We're also this year, we're launching 2 special new funds, the Healthy Mothers and Babies Fund and the Epidemics Fund, in order to direct resources where they're needed most. These funds will mobilize philanthropists and leaders, raise awareness, and invest in innovative ideas that will set precedent for 8.5 million New Yorkers. As a follow-up to this call, we'll be sending out an email with information on how you can connect and learn more about us and how you can support this important work. You can also get in touch with us and follow us on social media and subscribe to our newsletter if you haven't already done so. We also welcome your ideas for future topics to cover and how we might better engage with people like you as partners in our work. I will close with that, but again, thank you so much for joining. I hope you have a great rest of your day.
Thank you everyone so much. Have a great rest of your day, and we'll be in touch with some more information soon.